So this area is thigh. This is medial, lateral, superior, inferior. So today we will see the anterior compartment of thigh. So let's begin from here. So this is inguinal ligament, which is attached to anterior superior iliac spine and to the pubic tubercle. Now this area is called the anterior aspect of thigh. So let's see some structures. The structure here that you can see, that is intermediate cutaneous nerve of thigh, which is a branch of femoral nerve. This is lateral cutaneous nerve of thigh. Now we will see the other structure like this one. This is great saphenous vein, or it is also called long saphenous vein, which is draining into femoral vein. This is great saphenous vein draining into femoral vein. This is femoral vein. This one, femoral vein. So great saphenous vein draining into femoral vein. And great saphenous vein pierces the deep fascia of the thigh, that is fascia lata. You can see a part of the fascia lata here. Okay, and the cribriform fascia is a superficial fascia. The great saphenous vein pierces the cribriform fascia, and it is opening into the femoral vein. And this opening is called saphenous opening. Now we will see the muscles here. The muscles are adductor longus. This muscle, which is lateral to the adductor longus, that is pectineus. This muscle that is iliopsoas. Other muscles here, that is this one, Sartorius. This muscle, this is Rectus femoris, Vastus medialis, Vastus lateralis. Below the rectus femoris, this muscle, that is vastus intermedius. Deep to vastus intermedius, there can be articularis genu muscle. Here, this fascia here, this is fascia lata, deep fascia of thigh, and this side, it is thickened, that is called iliotibial tract, which is attached to the tibia. Above you can see there is a muscle that is called tensor fascia lata, which is attached to iliotibial tract. There is one more muscle which is attached to the iliotibial tract, that is this side behind gluteus maximus. Now let's see the area here, that is femoral triangle. Femoral triangle is bounded above by the inguinal ligament, and it is bounded medially by medial border of adductor longus and medial border of Sartorius. This is the apex of femoral triangle where two borders meet. This is the area where you can see a depression, that is called femoral triangle. In the femoral triangle, you can see many structures. This is great saphenous vein draining into femoral vein as explained before. And you can see some of the tributaries of great saphenous vein, like this is superficial epigastric vein. This is superficial circumflex iliac vein. These veins drain into great saphenous vein. Now the structures here are femoral vein, most medial structure. After that, this structure, that is femoral artery. Then the last structure here, that is a bundle of nerve here, that is called the femoral nerve. So the structures are from medial to lateral: vein, femoral vein, artery, then the femoral nerve. Femoral nerve has a lot of branches here. This is intermediate cutaneous nerve of thigh. Some of the medial cutaneous nerve of thigh can be seen. It supplies most of the muscles of the anterior compartment, especially the quadriceps femoris. This nerve is a nerve which is supplying the vastus medialis, that's called nerve to vastus medialis. There is one more nerve that is from the femoral nerve that goes along with the great saphenous vein, that is called saphenous nerve. So this is nerve to vastus medialis. This is vastus medialis. Okay, the muscles here, that is vastus medialis, rectus femoris, vastus intermedius, vastus lateralis. All these muscles together form quadriceps femoris, which is attached to the tibia. Now the femoral triangle, it continues as the next canal here, that is called adductor canal. Adductor canal is bounded below by adductor longus, then the adductor magnus. This muscle is adductor magnus. And above laterally, it is bounded by vastus medialis. Roof is formed by a fibrous sheath which is connecting adductor longus, magnus, and the vastus medialis. So this is the roof of adductor canal, and this is adductor canal. Through the adductor canal, the structures like femoral artery and the femoral vein, they will enter into the adductor canal, and it reaches adductor hiatus. Inside adductor hiatus is the opening in the adductor magnus. Then after passing through the adductor hiatus, it reaches popliteal fossa. So this is femoral artery and femoral vein, and the femoral nerves. Now this area is the medial compartment of thigh. This muscle here, that is Gracilis. Then this muscle here, that is adductor magnus. Above that here, there is a muscle that is adductor longus. Just below adductor longus, there is a small muscle here, that is adductor brevis. Adductor brevis. So this is adductor longus, adductor brevis, adductor magnus. Gracilis is supplied by this nerve. This nerve is Obturator nerve. This is anterior division of Obturator nerve. Adductor magnus is a big muscle here, which is supplied by some nerves. That nerves can be seen here. These are the posterior division of Obturator nerve, along with some of the branches of medial circumflex femoral artery. Now here, this nerve here, that is saphenous nerve, which is a posterior division of femoral nerve, which is going to continue downwards, and it is going to accompany this vein, that is long saphenous vein. So long saphenous vein accompanied by saphenous nerve. So as I mentioned before, this is adductor magnus. Below that you can see a muscle. This muscle is called semimembranosus. Semimembranosus. This muscle is a muscle of posterior compartment of thigh. This is another specimen. This is another specimen where we can see a superior inferior, medial, lateral aspects. So let's see the structures here. This is fasciolata, which is thickened to form iliotibial tract on the lateral side. Above, a muscle is attached to the iliotibial tract, that is tensor fasciolata. One more muscle that is attached to the iliotibial tract, that is this big muscle, gluteus maximus. This is rectus femoris, vastus lateralis, vastus medialis, vastus intermedius, which is beneath the rectus femoris. Another muscle which you can see here, this one, this is Sartorius. This muscle, that is adductor longus. Below adductor longus, this muscle, that is adductor brevis. This is Gracilis muscle. And this big muscle here, which is almost lying deep to adductor longus, this muscle, that is adductor magnus. And this muscle here, which is semi-membranosus. Let's see the structures in this area. So this region is called femoral triangle, which is bounded above by inguinal ligament and medial border of Sartorius. Again here, medial border of adductor longus. This is the femoral triangle. This is the base and this is the apex. The structures in the femoral triangle are from medial to lateral. This is femoral vein, femoral artery, and the nerves here are femoral nerves. The femoral triangle is going to continue downwards as the adductor canal. Adductor canal is bounded by adductor longus, adductor magnus, and above by this muscle, that is vastus medialis. There is a roof for the adductor canal, which is binding adductor longus, adductor magnus, and vastus medialis. So it's a fibrous roof on which there is a muscle that is called Sartorius. So Sartorius lies on the roof of adductor canal. So it's also called as, adductor canal is also called as subsartorial canal, through which the structures like the femoral vessels, they enter into the adductor canal. So there is a nerve here that is called a branch of femoral nerve, posterior division, that is saphenous nerve. Saphenous nerve is going to accompany the great saphenous vein. So this nerve here, that is a saphenous nerve. This is another specimen, superior, inferior, medial, lateral. So let's see this fasciolata here, thickened to form iliotibial tract, and above there is a muscle that can be seen here, gluteus maximus, which is attached to the iliotibial tract. There is one more muscle anteriorly, that is tensor fasciolata, which is not seen here. Anterior aspect, we can see quadriceps femoris, which consists of vastus lateralis, it's a broad muscle, vastus medialis, rectus femoris, and below that vastus intermedius. This is Sartorius. And the muscles here, this is adductor longus, Below that, this bulky muscle, that is adductor magnus. This is Gracilis. And this region is femoral triangle, bounded by medial border of adductor longus, medial border of Sartorius, above by inguinal ligament. The structures here are from medial to lateral. This is femoral vein, femoral artery, and lastly femoral nerve. Femoral artery has a big branch here that is called profunda femoris branch, which is a deep branch. So profunda femoris can be seen nicely here. In the floor of femoral triangle, we can see this muscle, that is Iliopsoas, which is forming the floor of femoral triangle laterally. This is the saphenous nerve, which is a branch of femoral nerve, which is going to accompany the great saphenous vein. So this is saphenous nerve, and this area we can see the adductor canal. Adductor canal here bounded below by this adductor longus, adductor magnus, and laterally by this muscle, that is vastus medialis. So there is a fibrous roof here that is forming the adductor canal. So fibrous roof is connecting vastus medialis to adductor longus and adductor magnus. So through the adductor canal, these structures, that is femoral vessels, are going to pass through. Superior, inferior, medial, lateral. Now let's see the anterior compartment of leg region. So here you can see the knee, and on the upper surface of the tibia, medial surface, we can see three muscles. This is Sartorius, and this muscle here, this is Gracilis, and this muscle, that is semitendinosus. So three muscles are attached to the medial surface of upper aspect of tibia. So Sartorius is from the anterior compartment, Gracilis is from medial compartment, semitendinosus is coming from posterior compartment. These three muscles are together called as gyropes. Otherwise, on the medial surface of the tibia, there are no muscles attached. Other structure that you can see here is the great saphenous vein. You may see the great saphenous vein from this area. This is the dorsal venous arch. You can see the medial aspect of dorsal venous arch is continuing as great saphenous vein. Remember, great saphenous vein is accompanied by saphenous nerve. Now, great saphenous vein begins on the anterior border of medial malleolus. So this is leg, superior, inferior, lateral, and this is medial. Now you can see a vein here. This is short saphenous vein. Short saphenous vein is located behind the lateral malleolus. So let's see the dysphagia here. Dysphagia here is dividing this leg into different compartments. You can see the dysphagia that is attached to the anterior border of tibia, and this fascia that is attached to the anterior border of fibula, and there is another dysphagia here, this one, that is attached to the posterior border of fibula. So we can see that there are three compartments. So this area that is between the shin anterior border where the dysphagia is attached and the anterior border of fibula where this dysphagia is attached, this area is called anterior compartment. whereas the area between this fascia that is attached to the anterior border of fibula and this fascia that is attached to the posterior border of fibula, this area is the lateral compartment and the remaining is posterior compartment. So posterior compartment is a big compartment. Now let's see the lateral compartment here. There are two muscles. This one is peroneus longus and the next muscle that is deep to it, that is peroneus brevis. So this peroneus longus and peroneus brevis, they are separated by the superficial peroneal nerve. We can see the superficial peroneal nerve. It supplies these two muscles, lateral compartment, and it continues as a cutaneous nerve. So it is like a muscular cutaneous nerve in the upper limb. So this is another specimen, superior, inferior, medial, lateral. This is medial. Now this muscle here, that is peroneus longus, deep to that peroneus brevis, and these two muscles are very close to the lateral malleolus of the fibula. There is a retinaculum here that is called the peroneal retinaculum, which is holding these two structures. Remember, peroneus brevis is close to the fibula. Peroneus longus lies over the peroneus brevis. This muscle, which is seen attached to the calcaneus, that is tendon of Achilles. Another specimen, superior, inferior, medial, lateral. Now this muscle here, this is peroneus longus and this is peroneus brevis. These two muscles are going below the lateral malleolus. And this area is the anterior compartment. There is a nerve here, that is the superficial peroneal nerve, which is a branch of common peroneal nerve, which is supplying peroneus longus and brevis. Note that peroneus brevis is very close to the bone. Peroneus longus is superficial to the peroneus brevis.